Good morning everyone. Today we're going to dive into section 3 of this video and we'll be talking about the structure of postgraduate training programs in the UK. We've got Apurva again with us today, and without any further ado, we'll just jump into this. So Apurva, could you please walk us through the structure of training program in the UK? How is it different from India, the role of Royal Colleges?
Yeah, sure. Welcome back everyone. So I think let's start with the very basics. What does the Royal Colleges do? So the Royal Colleges formulate the training structure in the UK, and they provide the curriculum for all the training programs in the UK. So there are different Royal Colleges for different specialties. For example, there is Royal College of Physicians, Royal College of Surgeons, Royal College of Emergency Medicine. They individually take care of different specialty training programs in the UK.
And how is the training, what are the big differences between the training programs, or what we call as post-graduation in India, in terms of these two countries? What are the big differences, kind of striking differences?
Okay, one of the very significant difference is the internship in India is for 1 year. The internship in the UK, it's called foundation year. It's for 2 years. The first year is called FY1 or foundation year 1, and the next year is called FY2 or the foundation year 2. Coming to the postgraduate course itself, so in India, most of the postgraduate course lasts for 3 years,
yeah.
Whereas in the UK it lasts for 6 years.
So that's the difference in terms of numbers of years. Are there any difference in terms of what residents are called as? So in India we call them residents. Now I've heard different terms here, ST, CT, registrar. What do they mean? Could you tell us what grade they are at?
Yeah, to make things simpler, residents and PGs are not the normally used terminologies in the UK. Most of the postgraduate residents, as you call them in India, are called trainees in the UK.
Okay.
And the PG program itself is called as training program in the UK. Right? So your next question, what is CT, ST and all these different terminologies? CT stands for core training or core training. For example, there are different numbers attached with these ST and CTs. For example, you would have seen CT1, CT2, CT3 or ST1, ST2, ST3.
The higher the number, the more senior you are.
Exactly. So for example, if you see CT3, ST3 along with somebody's name, that's called specialty training year 3.
Right. So what's the difference between specialty training and ST and CT and registrar?
Yeah. So there are few programs. For example, if you join general medicine training program, that starts as CT1, so core training year 1, and when you finish CT3 and when you give your MRCP exams, you become a registrar. So that's called as a middle grade level. And after your CT3, you start your specialty training. That's called as ST. In some program, for example, if you're doing a run-through emergency medicine training program, you start with ST1, that's called a specialty training year 1 program.
Fine. So ST1 that can go up to ST6, 7, exactly. And if you're doing sub-specialization, it can go up to 7, 8.
Yeah, true.
Fine. And I've also heard this. So is that equivalent to middle grade as well? What do you mean when somebody says I'm a middle grade or middle grades? What do you mean by that?
So
registrar? Or
middle grade is usually a registrar level, but
around ST4.
ST3, ST4 level is called as a middle grade level. So that's a kind of a generic term used for a registrar level job.
Right, makes sense. And now I have a question from the MD, MCH sort of thing that happens in India. So are there any degrees which we call as MD or MCH in the UK, or is it just an Indian thing?
So there are degrees called MD and MCH in the UK. We'll come to that later, but they are not as same as the Indian MD or MCH degrees.
So there are degrees.
Yes.
Like we can use post-nominals as MD or MCH.
Yes, true. But they're not equivalent to Indian MD or MCH degrees. The reason is, if you want to compare what is equivalent of MD or DM in India, so for example, if you complete your first 3 years of training in the UK,
as a CT or ST
as a CT 123 or ST 123.
Okay.
Then you give your Royal College exams, either maybe MRCP or MRCEM. That is kind of equivalent to doing MD in India. And once you complete your 6 years of training and you finish something called a CCT, Certificate of Completion of Training, then you give your another fellowship exams. That is equivalent to DM or MCH in India. For example, if you complete your 6 years of training and then you finish your FRCS exams, then that is equivalent to doing MCH in India. Then coming to your next question, are there any degrees called MD and MCH in the UK? There are, but these are mainly research oriented or academic degrees given by some universities rather than clinical degrees. So with your MD or MCH done in the UK, you can't get into a UK specialist register. You can't become a consultant in the UK just by doing MD or MCH degree in the UK.
So these degrees don't relate to bedside patient care. You might be doing some research.
Exactly.
You can't provide bedside patient care if you're MD or MCH. Okay.
True.
Fine. And what you said earlier, membership, now this is broadly, roughly speaking, membership exams, they are like more MD or MS, and fellowship exams, they are more like super specialization, which is MCH or DM.
Yeah.
Right. Makes sense. Now this is a question from one of my colleagues, and he was in India, and when he wanted to move to the UK, there were questions now at what post he would be appointed at.
Yeah.
Can you give us a sense of that? Like, what post do they join at? If somebody's finished MD or MS in India, and if they want to relocate to UK, generally speaking, now I know it's kind of difficult to precisely say about each person. Generally speaking, what level do they join at?
I think most likely it'll be ST3 or ST4 level.
Like a registrar level.
That'll be a registrar or middle grade level.
Middle grade.
But like you said, it'll be very difficult to say precisely what level they will be joining at. That depends on how much experience they've got, what exams they've done back in India. But generally speaking, you can join at ST3 or ST4 level if you've completed DNB or MD in India.
And I think from my personal experience, I can definitely say it's easier if you join at a more junior level where you don't take much of responsibility, because if you're moving to a new country, it's a totally different system. It's a new system, so you need time, at least a few months, at least I would say 6 months, to understand how things work, how the protocols and pathways and guidelines work, because this is a very guideline protocol driven environment. So you need a few months at least to understand how the system works. Would you agree with that?
I completely agree with that, yeah.
I think this is quite a complicated topic, and we just leave it here for now. And if you have any questions, please write to us in the comment section, and we'll probably do another video on that. And we hope you're finding these videos useful, and please let us know. We'll see you next time. Thank you.
Thank you.